Welcome to Silicon Valley Business, a show focused on highlighting the innovation and heart of Silicon Valley. I'm your host, Oscar Garcia, and today it's my pleasure to have Daniel, one of the co-founders of DrChrono. Welcome, Daniel. Thank you so much for being here.
Thank you. Nice to meet you, Oscar.
Yeah, so, let's start off, and you have a very exciting product, and I know you've been recognized by Inc. 500 as one of the fastest growing startups, but let's start off first by, tell me what electronic health records platform, what does that mean?
Sure. So electronic health records are basically digitizing paper medical records into a digital format. So what we're doing is we're taking paper and we're putting it into the computer world, into essentially the cloud. So you as a patient can say you're traveling into San Francisco and you hurt your leg and you go to a doctor that you've never seen before. We want to take that information and let you as the patient take that with you. Mm-hmm. I mean, you have your iPhone. Your iPhone has your banking on it. It has your contacts on it. It has your email on it. It has all of these different things on it. You should also have your medical record with you. So we're trying to enable patients around the United States to bring their medical records with them. On the flip side, the doctor should be accessing this data, right? So sometimes you take a prescription that you forget. If it's digitized, the doctor can see that and basically share that with another doctor, right? So it's sort of a record of like everything that had happened to you in your life. You know, people forget. You forget maybe a surgery even that happened. You forget what you're allergic to or allergies. And all of this is sort of like digitizing all of this in a way that the doctor can get it in a way that you can put data in fast. So like that's where we envision our company to go in terms of health records. But it's bringing your medical information with you. What happens right now is you call, say for your lab, right? You'll call your doctor and they'll say, where do you want me to fax it to? First of all, most people don't have a fax number. Mm-hmm. Then if you do have a fax number, you're getting it on a piece of paper. And generally when you're traveling, you don't have that with you, right? So it's nicer to get that on your phone. It's nicer to have that on the web.
Right.
And when it's actually digitized, other people can have access to it. And it creates a better care experience for you, because if a doctor knows everything that had happened to you across the span of X amount of years, they're going to be more aware of what they can do and what they can't do.
That's true.
Yeah.
No, that's super great. So we have a little short video. Why don't you walk us through your product here?
Sure. So what this is right here is a patient getting a notification from his physician's office about an appointment that they have. So we built a platform that allows the patient and doctor to know when appointments are. So the doctor's notified, and essentially this is the staff member scheduling appointments right here. Now the patient walks in and everything is digital. So the staff member hands the patient an iPad. The patient fills out all this information on an iPad instead of paper. The goal is to remove the paper from this whole workflow so doctors can get this digitized. And in real time, the staff member actually sees all of this information. But the great thing is the doctor sees this information in real time also. So this information is accessible for the patient, for the doctor. You can see right here what's going on as the patient is signing the HIPAA agreement. You know when you go to the doctor and you sign forms 10 times and you feel like you just keep signing the same thing? That's because it's all on paper and they're not sure if you signed it. Now you sign it once, you actually have it in the cloud and it's all there for the doctor. So the power of it is you as the patient can schedule from home. You can go into the doctor's office, they hand you an iPad, all the information previously is there from the last encounter. You fill it out or update information, say your health insurance changed. If your health insurance changed, the doctor will know that, and in real time they'll know what you're eligible for. So we actually have something called a real-time eligibility check, which means they'll know your copayment amount, they'll know your deductible, they'll know what you're covered for, so they won't even have to ask a lot of these questions. So it saves that time for the staff and it saves that time for the doctor.
Right.
And then when you walk into the back to see the doctor, it's all right there in front of him. Not just from this appointment, but from multiple other appointments and from other doctors. So we're pulling in from other doctors who are using DrChrono all this information, and it's all stored right there for the doctor. And then when you leave, you go home, you get a bill in real time of what was covered, what you have to pay, and you can also see all of that information and save it for later. So say you want to, see another physician, you could bring that with you. So we're trying to give that power back to the patient, but also to the doctors, so they're more aware of what's going on with patients.
Right. Where did the idea of DrChrono come from?
So me and my co-founder, we were in New York City originally. We're in Mountain View now. But when we started the company, it was just both of us, and we really saw that there was a problem with healthcare. And his family members were ill, my family members were ill at the time, and we noticed there is a lack of communication happening. There's so much that's not being conveyed between the doctors and the patients and other doctors to other doctors. It's such a stressful environment for them. They're seeing 30, 40 patients in a day. Sometimes they get the chart wrong. Sometimes they're pulling up the wrong medical record. And we saw how bad healthcare was in where we were. And we felt like that was a really good space where you could do good. And it's an impactful change doing something in that space. So we started the company, and we just kept learning more about doctors. So for the first year, we were shadowing doctors, looking at what they were doing in their offices. They were explaining to us, this is how I use paper. And we were looking at the paper actually that they were filling out, because there were no iPhones when we started. We started in 2009. I mean, there were iPhones, but it was just the beginning.
Sure.
There was no iPad. There was nothing, not a real tablet revolution. It was just in the early days when we were just trying to figure out this technology, and we were looking at the iPhone saying, how much medical data can we get on this device? Can we put prescription data? Can we put photos? Can we put videos? Can we put audio? And this is sort of unheard of, a multimedia medical record. This is, today it's very different, 2014.
Right.
Or if you take a picture of your leg and send that to your doctor, that's not unheard of today. But in 2009, that just didn't exist. But we saw the iPhone and we said, there's something here. And we saw the paper that all the doctors were filling out. We went into the doctor, we went into one physician's office, really prestigious hand surgeon, and he showed me, this is the size of the medical record. And he said, I don't review all of this. I don't have the time to review all of this. He's like, I just want the most critical information available at my fingertips when I want. He was telling me that he has a whole staff team that literally runs around trying to find all these paper medical records. And I'm just like, there's a need, and we just need to think about this a little bit and try to create a better solution.
Right.
And I would always talk about how we're competing with paper, literally. A doctor has so much time in the day. Do they grab a pen, or do they grab something else? And we wanted to be that something else that they were grabbing. So we were building in the cloud. We wanted it to be cloud-based, and the iPhone was out. So we were playing around with the iPhone, but we heard that the iPad was coming out. And this is around April 2010. And in April 2010, the first iPad came out, and we released our app. And that honestly changed the trajectory of our company. Thousands of doctors downloaded our app. We were the only medical record company on the iPad at the time. And a lot of people were telling us, this iPad thing is just a fad, right? This iPad thing the battery life's not good enough. The iPad can't be disinfected. If you drop it, it breaks. Yet doctors were buying them in droves. And people were buying this technology. And the iPad 1, the very first iPad that came out, we bought a bunch of them, and I put one on my desk and said, I want to see how long the battery life is. Is it an hour? Because I didn't, we weren't sure. The technology was so new. It was about 18 days till it died. And I was like, if something can last 18 days with our app running on it, I was turning it on and off, but I was doing a check. I was like, okay, It's day 4. I turn it on, it's like 89%. I'm like, okay, that's good. Let me play around with it for a minute, turn it off. Then as the days went on, I'm like, this is not a joke. Apple really built something that just works.
Yeah.
And the doctors knew it. Doctors want to use this technology, just people are not building the right things, and it doesn't work for them a lot of the time. So when you're seeing so many patients, you don't have time for things that are going to slow you down. You want to use something that's there and it's usable. And the iPad was honestly the right place at the right time, market fit for us.
Yeah.
There's a lot of different technologies you can build on, and there was something about the iPhone and the iPad that I felt like it was the paper replacement. So my co-founder Michael and I built the app, and it's here today. And we just kept thinking, how do you get more data into this device, right? It's really easy to consume data on an iPad, but we were thinking, how do you put data into this device? So we started to create things like, for doctors, we started to create things like medical templates. So you take your paper form, you give it to our team, we would customize it on the iPad for the doctor. So it could have multi-selects, single selects, macro buttons, free draw elements, all these different ways to sort of put data in very quickly that I don't think a lot of other companies were thinking about at the time. We were thinking that this has to be a consumption device. We had a doctor who came in to our offices about a week ago, Dr. Sadri, very prestigious doctor who was on Dr. Oz. And he came to us and said he loved our technology. And then another doctor who came into our offices said all he's using is iPad. And it amazes me when a doctor says to me, I'm only using an iPad. It shows me we're moving in that right direction.
Yes.
You're using your phone more and more for everything, to write emails, to do so many different things you never expected to do. And I think Apple is sort of on the right trajectory. They just introduced in iOS 8, you can, instead of text, you could put an audio, sort of a little audio piece in there. And I feel like the goal is to use tablet devices in the future, and it's very apparent to me that it's going to get better as the interfaces get better and as people think about this a lot more. And that's sort of the direction that we're taking our company in terms of that.
Yeah. Well, and as you're talking about, you touched on a lot of different things here, but one of the things, the medical profession, like the legal profession, are very slow to adapt technology. And so, I'm pleased to hear that you have doctors that are embracing the new technology, whether it's the iPad and certainly your application. Talk about some of the hurdles that you've had to overcome.
Sure. So that's actually a really good question, Oscar. A lot of hospitals already have software. $50 million installs, $20 million installs. What we did is we built medical records, practice management, and a medical billing platform, which is very similar to what they have in the hospital right now. There's a well-known secret in hospitals. Secret is doctors don't use the medical records. And we weren't going to replace it there. So we said, where can we start this? And the smaller private practicing physician is honestly where you can get a doctor to use this type of software very quickly. So we went off to the long tail market where there were single practicing neurologists, general practitioners who have 5 doctors in an office, 16 doctor practices. So we went after this very long tail of doctors. And that's part of our success. So it's sort of like, think of it like almost like the iPhone, right? The iPhone wasn't intended for hospitals. It was intended for the consumer. So we took that same approach, a consumer-centric approach. Let's go after the lowest, the roots doctors who are out there, not the huge hospitals making all of this money, and they've already bought all of this software that they just sort of set in stone, and we're not moving in the right trajectory sometimes. We wanted the doctors who needed something immediately. So we'd go into these smaller doctor offices. Me and my co-founder would go in, talk to the doctors, shadow them, hear their feedback, and build. And we just kept doing that. And from there, we just kept getting more and more and more doctors. And there's a need, and doctors see it. I mean, I would go into a doctor's office and I would see a green screen old terminals. You know, they've used this has worked since the 80s, but I hear the iPhone is really good. You know, I'll get feedback like this. I want to use my iPad in my practice, but this green screen doesn't work for that. How do I change? You know, we get all different types of doctors. I had doctors that they get upset. They bought something for $100,000 and it doesn't work for their practice, and they're upset. So they come to us and say, how do I get my iPad to work for my practice? So we get a lot of these doctors who are looking for something that will just work for them and let them take care of patients instead of trying to figure out how to use software that's very, very complicated.
One of the things that's been in the news of late is the hacks. People, whether it's photos, celebrity photos being stolen, or credit card information. Target, several months ago, recently Home Depot was hacked. And how do you address the issue of security, especially when it comes to medical records?
Sure. So we follow HIPAA. So HIPAA is a guideline that's out there. That's one of the basic things. We also follow meaningful use. So meaningful use is basically a certification that you can get to state that you are a government certified medical record company. Between the technology, our development operations team, between HIPAA, between getting that certification from the government and having third-party companies come in and actually review our hardware and software, it is industrial-grade security. So we go to great lengths to make sure that the security is very good.
To do it. So DrChrono was voted the #1 electronic health records by Black Book for 2 years consecutively. Talk about that award, and what does that award mean to you guys?
Sure. So there's a third-party company, Black Book Rankings, and essentially what they do is they go out and talk to doctors in hospitals, in smaller practices, and they ask them, what EHR do you prefer? So we won that award based off of all these professionals coming together saying, this is the most usable medical record in my practice. So it was a really proud moment for us.
Absolutely, yeah.
Especially when it's thousands of doctors coming together saying that. It's definitely a triumph for us. And it speaks volumes. In the Apple App Store, we're actually ranked, just from user reviews, the top rated medical records app in the iTunes App Store.
Oh, wow, okay.
Yeah. So that's the users talking, saying this actually is usable. This is actually a usable product in my medical practice. It's really exciting. Yeah,
well, congratulations, because if you're receiving that validation from doctors and the consumers, I mean, that's, from both ends. So congratulations on that recognition.
Thank you.
Talk about the culture at your startup. I think you said that there are 30 employees, so it's actually a very good, sizable startup. And I know competition for talent is very high here, especially in Silicon Valley. But tell us what it's like at your company.
Sure. So culture is a really interesting thing at our company. I think about it a lot. My co-founder, Michael, thinks about it a lot. It's important to have a culture where people can get things done. We're always looking at members who have done things in the past. So just in the hiring front, we look at people that have done something exceptional, right? We had one engineer who showed us something he built just for fun. And it was this impressive social network for his friends. Things like that really stand out to me and to my co-founder. So just on the hiring front, I think hiring is extremely important. You want to hire the right people that have the right attitude. Startups are generally harder than working at a larger company. So you're going to hit a lot of roadblocks, but you have the power as an employee of our company to make changes. So we feel like the best people for us are the people that are sort of the get things done type of people that do things very quickly and just sort of can take on a challenge, internalize it, and then produce a very good output. Because there's a lot of barriers when you're a startup. How do you do marketing when you're competing with multi-billion-dollar companies? How do you create a product that's better than a multi-billion-dollar companies? How do you create motivated salespeople? How do the engineers build at a rapid pace without feeling hampered?
Right.
How do you build secure software in parallel? A lot of these are the questions that we think about a lot. And I think rapid iteration, also when you get feedback, is critical to our company. So, doctors give an immense amount of feedback. And I hear this a lot. A doctor will say, well, I gave that feedback and it's actually in the product now. I'm not leaving. Like, this is the best thing ever. They actually listened to me. I paid for this other software, 5 years ago, and they didn't listen to me. So a lot of the doctors stay because they see progress every single day, and it excites them. They sort of get that, and they see we're a feedback-driven company. We hear their what they need, and we build that in as fast as we can into the product. And I feel like the software itself is not it's not stagnant. We have to keep changing it. So I see it as like an organic living thing that sort of is always changing, and we're always refining it and making it better.
Yeah. When so you've had your company now for 5 years, I think you said, and what advice would you give someone who wants to start their own company?
I would say there's a few critical things. A lot of people will give you feedback, a lot of advice that you can get for free, but the best advice is from the users who are paying you. I think if someone is willing to pay you, it creates a certain type of user that actually really relies on you. So the very first paying user you get, if you listen to them, you'll get 1,000 users. If you listen to them, you'll get 10,000 users. If you listen to them, you'll get 50,000 users, and it goes from there. So we got a lot of advice for free. It's the paying users who you should really hone in on and sort of just focus on them.
No, it kind of reminds me of, like, for me, working at the chamber and getting the feedback from our members, and even those that choose not to renew. That's very important always to be constantly getting feedback. You call it users, and I call it chamber members. So no, absolutely. What has when you look back in the last 5 years, has there anything occurred that maybe that you didn't expect, or a surprise, or maybe a challenge or obstacle that you just look back and realize, like, if I would have known this when we started our company, I would have done something different?
Sure. I mean, I think that's going on now, and it's going to go on for a long time. I think managing a large team of 30 people takes a lot of effort, and you want to manage people in a very motivating way, right? So how do you do that? And I continually ask myself this question, and I feel like that in itself is a huge challenge for as our team, making people happy, making them feel like they're good collaborators, making them feel like they have a good voice. That's something I'm always learning, how to be a better leader. There's always other types of challenges, right? What technology should we build on? What partnership should we work on? I mean, when you have so many options as a startup, you really have to focus and say no to a lot of things also. So companies will approach you that you feel like, this would be great, but we only have so much time and resources.
Right, yeah.
So you want to pick and choose what you do very wisely, because if you sort of become scatterbrained and become a master of none, you sort of lose that focus. And I feel like for us, we've gotten pretty good at saying no a lot because there's so many opportunities. We turn down opportunities now, and it's about what are our core values as a company? Mm-hmm. Creating a better doctor-patient experience, right? And if it doesn't really help with that, we sort of say no to those type of partnerships or whatever it might be.
Mm-hmm. Yeah, so I'm listening to you. It reminds me again of the chamber where I've recently had coffee with someone, and I told him that probably one of the hardest things that I've had to learn at the chamber is to learn how to say no to people without hurting their feelings. Because to everyone, their initiative is the most important thing. But you have to focus. You have to stay focused on what's important to you. In this case, to your company and your mission and goals. But so Daniel, let me ask you another question. Who inspires you?
I think other great companies. I look at companies like Facebook. How did they build the real social network with real people, right? How did Apple create such a great product? How did Amazon become such an amazing place to buy things from? Mm-hmm. I look at all of the best companies out there, and it sort of creates inspiration in me when I look at them and say, how do we bring that to healthcare, right? You go into a hospital room and you're not inspired by the stuff that's there right now. But if it actually inspired you and you said, oh my God, this makes me want to take better care of myself. This makes me want to talk to my doctor more. This makes me want to take care of my kids more. This makes me want to take care of my parents more. I think all of those companies, all these great companies that are doing really great things, they all have something to show the healthcare community. Mm-hmm. And I feel like that's where I take a lot of the inspiration from.
Yeah. Well, Daniel, I want to thank you for inspiring me. And as I mentioned to you when I first reached out to you, I've been seeing a lot of press coverage on your company. And, we met, I think, over a year ago. And to see the growth and the recognition and the awards that you're receiving and what it is that you're doing in the healthcare industry, I want to applaud you, Michael, and the rest of your team, and certainly wish you continued success. So thank you very much for being on the show today. Until next time, thank you, everyone.